Hi, I'm Patricia Driggers. I am the portal registrar and the education specialist for HPN. And today we're going to talk about the E in AIDET plus the promise. And the E in AIDET stands for explanation. So we're going to focus on explaining. So a breakdown of explanation is just explaining step by step what's going to happen, asking for questions and making sure that you answer them or find out the answer to the questions, and also leaving contact information. Those are the important parts of explanation in AIDET. So when you explain in detail, you're actually proactively answering questions for the patients and helping to keep them informed. So some of those questions would be answering why. Why is this procedure being done? Or what? What is going to happen? What can the patient expect? And when is it going to happen? How long will it take? And then make sure you ask the patients, what questions do you have for me? And remember, they'll more than likely have a lot less questions just simply because you explained everything so well to them. So explanation is synonymous with accurate communication. So there are two parts to communication. You verbally communicating to the patient, but also patients want to know that you're listening to what they say. So sometimes the explanation is just repeating or reiterating what it is that the patient said. So in this example, you ordered the meatloaf with broccoli, macaroni, and cheese, and an unsweetened iced tea. Is that correct? The chef's meatloaf is delicious, and I hope you enjoy it. So see, you're reiterating basically what the patient is saying. Now, the explanation in AIDET, you want to make sure this is good for both clinical and non-clinical procedures, and also this is important for communication on an associate-to-associate basis. You also want to make sure when you are explaining things to patients that you don't use industry jargon that they won't understand. You want to make sure that you're speaking in layman terms. So, what does taking the time to explain in detail accomplish for you? Well, first of all, the patient is more likely to do it right, which actually makes your job easier. And also, less assumptions and more communication helps workflow. So again, that makes your job easier. When patients are less anxious because they're not sure what they're supposed to do, then we have improved outcomes. So it is definitely worth the time to make sure that you're explaining things by detail to the patients. And in this way, you're actually helping the patient to help you by taking the time to explain. So let's talk about what would Hank do. Our mission for Hancock Health is to be a caring community partner by healing, improving health and wellness, alleviating suffering, and delivering acts of kindness one patient at a time. Remember, we want to leap, and that's exactly what Hank likes to do. So if we leap, taking the time to explain is delivering an act of kindness. What a great way to leap, and what a great way to act out our mission statement. So let's make a commitment to serve with excellence by caring enough to explain to our patients. What better act of kindness could there be?